Sa dami ng virus mutations ngayon, nagkakaroon na ng diskriminasyon sa mga bansa kung saan nanggaling ang virus.
Whenever these variants are detected all over in other countries, it ends in stigmatizing that country or those people from that country. And then the other people in those places start looking at them with suspicion, like, okay, you're bringing this to our country, right? So that's what we want to minimize, because it's not the people, it's the virus, right?
Saan nga ba galing ang pangalan ng virus mutations?
At sa the beginning, ang ating mga audience familiar sa pangolin kasi naririnig ninyo kami nagsasabi ng B.1.1.7. So it's really based on a global phylogenetic tree. But what is the meaning of pangolin? So pangolin po is called the phylogenetic assignment of named global outbreak lineages. So this is really an application that was developed by the UK SARS-CoV-2 or Coronavirus Genomics Consortium. So they developed this lineage para matulungan yung global community. First, malalaman natin yung interrelatedness at kung paano nag-i-evolve ang virus.
Kamakailan inilabas ng World Health Organization ang new naming system para sa COVID-19 virus mutations.
You have the pangolin system at saka meron ding next strain, may decade, na yung haba ng mga pangalan nila at saka siguro mga scientists lang ang makaalala. So nag-isip talaga yung ating WHO ng isang system na madali sila maintindihan na ang qualification should be non-stigmatizing and easy to remember.
We had a very large committee of experts joining WHO. Many of these people are scientists. They are not WHO people. They are global experts. We could find what is the consensus we can arrive so that we do not stigmatize people and countries. And after much discussion, they decided that it's best that we use the Greek alphabet to identify these variants of concern or variants of interest.
Isa-isahin natin ang Greek letters na naka-assign sa bawat variant of concern o ang mga virus strains na mas nakakahawa. Nagiging sanhi ng severe disease at maaring may epekto sa bakuna.
So, if we look at the variants of concern, now we identify clearly 4 variants of concern. The alpha was what we knew as the B.1.1.7 variant or the UK variant. The beta is the B.1.351 variant or what was known as the South African variant. The gamma or the P.1 variant is the variant that was originating from Brazil, and then we have the latest, the Delta variant or the B.1.617.2 variant, which is linked to India. So these are the 4 variants of concern that WHO is asking countries to monitor very carefully, because each of these variants of concern have unique characteristics linked to them.
Samantala, narito naman ang mga Greek letters na napili para sa mga variant of interest o yung mga virus na mayroong kakaunting pagbabago mula sa mga naunang variants at hindi pa makukonsider na lubhang nakakahawa o may epekto sa bakuna.
So, in line with that, we have what we call the epsilon variant or the variant of interest, which is epsilon, which is linked to the US, originally recorded from the US. We have the Zeta variant or the P2 variant, which is again linked to Brazil. We have the Eta variant or the B.1.525 variant, which has been recorded from multiple countries. We have the Theta variant or the P3 variant, which was the variant we detected from the Central Visayas in the Philippines originally. We have the Iota variant or the B.1.526 variant, which was also detected in the US. And we have the Kappa variant or the B.1.6171 variant, which was also detected in India. And finally, we have the Lambda variant or the C.37 variant, which was detected in Peru.
Sa ngayon, naka-alerto ang buong mundo sa Delta variant dahil mas mabilis itong makahawa kumpara sa ibang variants.
Pero yung Delta variant, kaya niya mag-infect ng 5 hanggang 8 tao. In addition to that, it appears to be more transmissible, probably 60% more transmissible kaysa sa UK or the Alpha variant, no? So sabi ng mga scientists, parang yung fitness na to infect, yung pagkapit sa cells, mas na-refine pa, no? Tapos pang-tatlo, parang ang kanyang symptomatology, yung mga symptoms na nakikita ng mga doktor natin, parang nag-iba.
Nababahala rin ang mga siyentipiko dahil sa mataas na posibilidad na ma-ospital ang sinumang tamaan ng Delta variant.
People are more likely to be hospitalized with the Delta variant. This comes from the Scottish study that was published in the Lancet Journal nitong June 14 lang. Sinasabi nila na may double daw ng risk of hospitalization compared to the Alpha variant. Grabe, may Alpha variant na, tapos the Alpha variant, itong Delta variant, double the risk of hospitalization. So these are the early signs of the Delta variant, and there is a possibility na baka yung mga bata ang kanyang mga na-infect at nag-spread. Pero syempre wala pa tayong consensus doon sa mga bata kasi yung iba suggests na most likely, yung iba naman hindi, but also because marami kasi sa mga bata hindi pa sila na-vaccinate, di ba? Since hindi sila na-vaccinate pa, posible talagang sila ang ma-infect at sila ang makapag-spread. So this is also an area that is also concerning.
Umaasa ang mga eksperto na tuluyan ng mawawala ang diskriminasyon sa mga bansang pinagmula ng virus dahil sa bagong naming system.
And so we need to undo that a little, but hopefully in the future, because we now have these Greek lettering, we can prevent future stigmatization of other locations and other countries, because certainly the Delta variant is not the last variant that is going to happen, right? There's going to be other variants that appear.
Paalala ng mga eksperto, patuloy na i-monitor ang Delta variant at tiyaking makuha ang 2 doses ng bakuna para mas protektado.
1 vaccine dose is less effective. Pero pag 2, strongly protective. Kaya very important na matapos mo yung 2 doses. Very, very important for everyone not to be complacent. We should always practice the minimum health standards for our establishments, to have the proper engineering controls or measures in ventilation as well as in social distancing, to ensure that everyone is safe, and also to keep our families, our neighbors, our colleagues, our friends and the community safe.
So we are working together with the government to see how much we can delay a potential arrival and spreading of the Delta variant, because the way we see it, we have a very unique window that if we can hold out the Delta for long enough and vaccinate as many elderly and comorbid people, we will prevent people falling severely ill and dying during the next surge. So that's why we continue to say, use the vaccines you have now to protect those most vulnerable people, because when the surge happens, then you won't see a lot of deaths.
Cases of the coronavirus disease, or COVID-19, are rising across the world. To prevent it from increasing further, here are some tips to find out whether or not you have the virus. Did you travel in countries with cases of local transmission or areas placed under enhanced community quarantine for the past 14 days? If so, have you experienced fevers reaching 38 degrees Celsius or coughs and colds? If you have travel history but do not feel such symptoms, you are considered a person under monitoring, or PUM, who needs to be quarantined at home or in the barangay isolation units. No test is required, but your condition will be monitored for 14 days while under quarantine. If you feel such symptoms, you are automatically considered as PUI. Those without condition in addition to the COVID-19 symptoms may be dismissed and subjected to home quarantine or barangay isolation units after the test. People with additional conditions will be admitted to the designated COVID-19 isolation area. If you have no travel history but have experienced fever, coughs, and cold in the past 14 days and have been exposed to COVID-19 patients such as the following: provided direct care for COVID-19 patient without personal protective equipment or PPE, worked together or stayed in the same close environment with COVID-19 patient, traveled together with COVID-19 patient in any kind of conveyance, living in the same household as COVID-19 patient. You are still considered as person under investigation or PUI. Here are some steps to follow if you have a person under monitoring in your home. Notify your barangay health worker immediately if you have a PUM at home. PUM should be placed in a well-ventilated room within 14 days. Make sure the windows are always open to allow the circulation of fresh air. Keep a 1 meter distance from the PUM and make sure that he or she sleeps in a separate bed. Make it a habit to disinfect items, especially those that others frequently touch, such as doorknobs, tables, and chairs. Wear gloves when cleaning your home. Take a bath or wash your hands immediately after cleaning. It is also necessary to have separate plates, glasses, spoons, and towels for the PUM companion. Avoid sharing meals with the PUM. Check the temperature of your PUM companion daily. When he or she has symptoms of COVID-19 such as coughs, colds, and severe fever, immediately take him or her to the nearest hospital or call the hotline 02-894-26843. For more information on COVID-19, visit ncovtracker.doh.gov.ph.
For more updates, please share, like, and subscribe for V News and Trending.